Hey everybody, welcome. This is our first little mini lecture video in our class, and I just want to say welcome to you. You're going to get used to looking at a few of these videos as we go through the course of the semester, and because I'm going to be posting in between classes, some weeks a couple of videos and some just one video, but this is just kind of my way of kind of filling in the gaps a little bit since we have kind of limited time in class this semester. I'm going to try to use some of these videos to help us kind of just, again, expand a little bit about what we can talk about because we do have some limited time in class. And these videos are really intended to complement the PowerPoint slides that I've also attached and made available for you as well too. So instead of talking over my PowerPoint slides, what I've got is two separate things. You've got the PowerPoint slides, and then you have this video, which can and they're intended to be complementary. And so what I'm going to be sharing really just in the next just few minutes or so as we get started is also contained in the PowerPoint slides. So this PowerPoint presentation just has 5 slides in it. So it won't take me too long to kind of just go through and kind of hit some high points. And as we'll talk about maybe in class, there's going to be some class sessions where we also hit on some of this as well too. There's some information that I may only mention here in the videos, and then there's going to be some information that I may hit in the videos, but also too in class as well too. So the best place to start for our class is to talk about what are co-occurring disorders. Obviously, the name of the class is co-occurring disorders. And this is a term that several years ago I had never heard of before. The term co-occurring disorders is a fairly new term in this sense. It's a term that in our field of counseling today, we hear a lot. We hear the term co-occurring disorders used a lot. And when we hear it used, it is specific to a specific type of situation with a client. We can use the term co-occurring disorders in a variety of ways, but this class is about that specific situation, those specific situations that we're going to kind of highlight here in just a second when it comes to a person's experience. Co-occurring disorders are sometimes also called dual disorders or dual diagnoses. You sometimes hear those terms used. The more common term, the newer term, is the term co-occurring disorders. Some of you have been with me, many of you have been with me in the abnormal behavior class, and you're familiar with the term comorbidity or comorbid. The term comorbidity is synonymous. It means the same thing as co-occurring. And so comorbidity and co-occurring are the same thing, basically. And what it means is we use the term comorbidity or co-occurring when you have a situation, as the name implies, where you have a person and they have two different struggles or two different diagnoses or two different problems at the same time. And those two problems are separate and distinct from each other, but they're interrelated with each other, which we're going to hit on here in a second. And so co-occurring disorders refers to a situation where a person has some type of persistent presence of or history of or struggle with a mental health condition. So again, I mentioned the abnormal behavior class, and that's the class where we discuss all those different mental health conditions out of the DSM-5. And so I've got another video that you're going to look at just around a quick introduction and overview of mental health conditions. Most of us are familiar with kind of what we're talking about when we talk about mental health conditions. So a mental health condition, someone is struggling with or has been diagnosed with or is being treated for something that we would just call a mental health problem or condition. And alongside that, here's where the co-occurring comes in. Alongside a mental health struggle, depression, schizophrenia, anxiety, dissociative disorder, eating disorder, alongside, in addition to those mental health struggles, they also are abusing substances. That's the co-occurring. So we're going to talk a little bit in class about the term substance use disorder. That's the term we use in our field now. It comes right out of the DSM-5. The term substance use disorder, or SUDS, is oftentimes what we just refer to it as. A substance use disorder is, we sometimes simply just refer to it as a drug and alcohol problem or a substance abuse problem. Someone is actively using substances or abusing substances, and at the same time, they often are also struggling with a mental health condition, depression, anxiety, or something else. So that's the co-occurring. The two, anytime you hear the term co-occurring, it means at least two things are kind of happening at one time. And so with co-occurring disorders, it's mental health conditions. A person is struggling with a mental health condition of some sort, or conditions plural. It doesn't have to be one, it could be multiple mental health conditions. And at the same time, usually when we use the term co-occurring disorder, at the same time, they are also using or abusing substances as well. And that substance use has kind of risen to the level of what we would call a substance use disorder. So that's what co-occurring disorders is. You'll see in the PowerPoint presentation, a little definition, little diagram, little visual I give you to kind of show you a visual representation of what co-occurring disorders are. And so that's kind of what the class is about. That's what we're going to be talking about in our short semester here, is talking about situations like that, clients like that, people like that. Maybe you have family members, maybe in our own lives. At times we've had both drug and alcohol struggles and also mental health struggles, or one or the other. And so the idea with the co-occurring disorder is that those struggles continue, are basically present at the same time. I want to highlight for you, as I do in the PowerPoint, just really, there's so much we could say as far as introduction. This is really just intended to be kind of a quick overview and introduction of co-occurring disorders. I want to just highlight three things just really quickly about co-occurring disorders. And there are three C's. All of them start with the letter C. So number one, co-occurring disorders are common. As you can imagine, if I were to ask you today, are mental health struggles rare or common? Every single one of us would probably say, well, they're pretty common. Lots of people struggle with mental health conditions. If I were to ask you today, is substance abuse rare or common? We would say it's common. Lots of people, not everybody, but a lot of people struggle with drug and alcohol problems, and a lot of people also struggle with mental health conditions. So that right there highlights for us that situations where you have a person who is abusing or using substances and also too struggling with mental health problem, that co-occurrence is very common. There's all kinds of research. You get different statistics. I saw a research report recently that said about 35% of people with mental health struggles also abuse substances, and about 35% of people with drug and alcohol problems also have mental health conditions. That's 35 out of 100. That number seems low to me. I also saw another research that says about 50-50 probably, that about half of the people diagnosed with a mental health condition probably at some point in the past or present are actively using substances, and about half of the people who abuse substances probably have a mental health condition. That number feels more closer to the ballpark to me. I don't know what the definite number is, but it's very, very common. If you're in the class and you want to be a mental health counselor, you're going to encounter many clients who you talk to about mental health struggles who are also using substances. If you're in the class and you're an LCDC student, you want to focus on drug and alcohol counseling. I'm glad you're in this class. I'm glad you take the abnormal behavior class, because a lot of people who we see in drug and alcohol counseling settings also struggle with depression or anxiety or post-traumatic stress or whatever it may be. Fairly common. So co-occurring disorders, the first C is they're common. Number two, as you can imagine, co-occurring disorders are also complicated or complex. We're going to get into some of that in the course of the next several weeks. They're complicated to assess and treat. They're complicated to understand. They're complicated for the person. Mental health conditions are often multi-layered and complicated. Well, in addition to that, you put alongside that in a person's life the fact that they're also getting high every day on marijuana, or they're using pain pills to help them get through the day, or they're drinking alcohol to help them feel less anxious or go to sleep at night. So you already have a complicated situation like someone's depression. If someone struggles with depression, that's complicated enough as it is. Well, then if you add alongside that this persistent substance use or abuse, that complicates it even farther. And so co-occurring disorders are complex. Now, that's not a negative, it's just a reality. They're complex to understand, they're complex to evaluate appropriately and to treat and to counsel. They're complicated in how they affect people. So they're common, they're also complex. And then the last C is they're complementary. And so I'm going to talk about what I mean when I say that last C, complementary. Another term is the term reciprocal. So the term reciprocal means two-way street. Reciprocal means back and forth. And so we're going to get into this in the next couple days, but co-occurring disorders are often quote unquote complementary. And what I mean by that is, again, we're talking about two different struggles: mental health struggles and substance use disorder struggles. Those two, I'll use my hands here, those two struggles are often like this. Does that make sense? If that makes sense. They're interwoven with each other. My depression, for example, a mental health struggle, because of my depression, it may be hard for me to sleep at night. So what I begin to do is I begin to drink a little wine or something at night to kind of mellow me out a little bit, and that helps me then to go to sleep. And if I'm not careful, before too long, I'm drinking too much alcohol, and now I can't go to sleep unless I drink. And so you have this mental health problem and this substance problem that are kind of interwoven. Why did I start drinking? Well, because I'm depressed. And so this idea where a mental health struggle can often lead to a self-medication situation of using substances. That's how that's how co-occurring disorders are complementary in one way. And we're going to talk some more about that here in the next couple of days. So that's one example. The other example I'll give you in the PowerPoint slides is this idea that sometimes certain substances, the overuse or abuse of certain substances, can actually bring forth or cause certain mental health struggles. And so sometimes people aren't self-medicating. Maybe they've begun to abuse certain hallucinogens or certain pain medication. They've begun to drink heavily, and they're not doing that to a self-medicated mental health struggle. Maybe they did it just to kind of relieve some stress, or maybe they did it because it's a social situation or whatever it may be. And they begin to abuse substances. And sometimes the overuse or abuse of certain substances over time can begin to create mental health symptoms in a way, like depression. Sometimes depression comes first. Sometimes depression, for example, comes second. It comes as the result of someone using or abusing substances. Another example, I think of a former student of ours who shared in class just 2 or 3 semesters ago about how, for example, they began to struggle with substance abuse. They were introduced to certain substances at their work site. They were working, and their coworkers were abusing certain prescription medications after work. And they got introduced to that through their coworkers, and before long they were dependent and they were addicted to those substances. Well, because of their addiction to those substances, their girlfriend left them. They lost a bunch of money. They lost their job. They're alienated from their family. They feel out of control. And that brought on, he shared in class, he said that brought on depression then, because now this girl I love is gone, and now I have no money. This job that I loved is gone. So substance abuse sometimes can lead to certain mental health conditions or mental health struggles is another example of how they're complementary. This complicated kind of interweaving that you see between substance use and mental health conditions. And then the last one that I have also in there too, which we're going to talk a little bit about. All these we're going to talk some more about. But the last example of complementary, because there's really several examples, but the last one I put in the slide for you is the idea that sometimes the use of certain substances can make mental health symptoms worse. Would be another example. So for example, someone feels depressed, and so because they feel isolated and alone, they begin to drink. And initially, when they begin to drink, that drinking may numb their pain and may give them a sense of, it gives them a sense of comfort or whatever it may be when they begin to drink. But that goes away. That's not temporary. That's not permanent. It's temporary. And what happens is I may begin to drink and to kind of deal with my depression and isolation. But sometimes alcohol makes those feelings worse. And so while I'm intoxicated, I feel numb, I feel great. When I sober up, now I feel even worse than I did. So what happens now? So I drink more. I begin to drink more because now my depression is worse. Well, the more I drink, once I sober up, guess what happens? Well, my depression just keeps increasing. And so you get this cycle, this reciprocal, complementary, kind of cycle that can happen between the two, I'll say the two issues, mental health and substance use disorders. So they're often interwoven with each other. That's also too, the second C I gave you was complex. It's part of the reason why, one of the reasons why substance use disorders are complex and complicated is because of the reciprocal back and forth interweaving relationship between substance use and abuse or substance use disorder and a mental health condition. So we're going to kind of unpeel a few of those things as we kind of go through. But like I said, the co-occurring disorders are complicated, and so we may not always have easy answers. But we're going to talk through some of those issues as we kind of get going. So take a look if you haven't already done that. Take a look at the PowerPoint slides. Again, there's just 5 of them. Take a look if you haven't already done that, and come to class. Make sure you're in class, and when we meet, and come back and check out the next video that I post for you. I'll see you then.